So while I'm doing my best to tell you what we are doing to combat the virus, and although I can tell you I'm in touch with many leaders and many other providers in the senior care space, I could not tell you what their plans are. So I can't tell you if we're doing better, I can't tell you if we're doing worse. I can tell you that we were early adopters. I can tell you that there are many protocols we have in place that they haven't made decisions yet to go to that extreme, but that sometimes is a product of the environment that they live in, because they live throughout Texas and they're not fighting it maybe in the same level that Dallas County or Dallas is fighting it. So all of those things are variables, and so I always say comparison is a lose-lose proposition. I focus on myself, this team, this community, and what do we know? And what we know today is so significantly different than what we knew 6 weeks ago. And we are all staying as informed as we can and making the best decisions possible. Sometimes this can feel like a contradiction of information, and I've heard this criticism levied against public officials. But the reality is what we knew yesterday all changed when we woke up this morning and the statistics changed. And so then it makes us take a next step in what do we need to do now. When I think about Judge Clay Jenkins, and you all have seen him on news conferences, and he's got the weight and the burden of protecting Dallas County. That's millions of people. And I think that where they started to where they were Sunday night, which was the last press conference I saw with him, is he's been looking out into his community and seeing levels of non-compliance and seeing that the Dallas County numbers go up of positive cases, and then sadly also from deaths related to it. And he's feeling the weight of that. And so, we're all just making those choices every single day, contributing to that. But the reasons he's coming back and making changes with our city governments is because he's trying to combat what maybe is not collectively happening in our community. And that's the same thing that we do. And so no one can tell you anyone has the best practice or the most secure and succinct practice, because that would be a false endorsement. We are doing what we can to limit the spread, reduce exposure, and save lives. That's it. And that's really all I can speak to, and I'm going to let other communities and other facilities do their best as well, and I'm counting on them to do their part, just like I'm counting on us to do ours.